Good morning. My name is Melissa Fetterman. I'm the Troy Hoff Chair for Health Planning and the Director of the AIDS Funding Collaborative at the Center for Community Solutions. And it is my pleasure to welcome you today to the Center for Community Solutions Human Services Institute, Generation Unbound, Drifting into Sex and Parenthood Without Marriage, a hot-off-the-presses book by Dr. Isabel V. Sawhill. Today's Institute is the last of 2014 and concludes our 72nd year, providing a venue for Northeast Ohioans to convene and create community solutions together. For over 100 years, the Center for Community Solutions has provided strategic leadership and organized community resources to improve health, social, and economic conditions. We have accomplished this through applied demographic research, nonpartisan policy analysis, advocacy, and communications. It is now my pleasure to introduce Vice President of Marketing and Communications for the MetroHealth System, Elizabeth Allen.
Thank you, Melissa. Welcome to MetroHealth. I'm glad that you all made it here today. I know it's a little dreary, but it's the beginning of the long dreary season, so we need to buck up and come and convene today. Welcome to MetroHealth. This is a very special place. Our mission is to lead the way to a healthier you and a healthier community. And one of the things that we know quite well is that there are so many people in the community who have good ideas and good practices, and that collaboration always brings better solutions for everybody in our community. So we're so thrilled that you're here today. This is an incredibly important topic. And I know that I have a daughter who's just about to get married, so I'm extremely interested, and I'm going to give her your book for Christmas. It's a really important topic. Children are so important to this community. We do things with taking care of the foster care kids, bringing health care to the school system. Dr. Baylett here runs a program of managing dependency for mothers and kids, so it's a very important subject for us all. So welcome to MetroHealth, and I hope you enjoy your day here. Thanks, Melissa.
Thank you, Elizabeth, for your remarks and for hosting this forum today. We sincerely appreciate MetroHealth's hospitality and the support of this institute. And now it is my pleasure to introduce our speaker for today, Dr. Isabel Sawhill. Dr. Sawhill is a senior fellow in economic studies at the Brookings Institute, where she serves as co-director of the Budgeting for National Priorities Project and co-director of the Center on Children and Families. She also holds the Cabot Family Chair. In 2009, she began the Social Genome Project, an initiative that seeks to determine how to increase economic opportunity for disadvantaged children. Prior to joining Brookings, Dr. Sawhill was a senior fellow at the Urban Institute. She also served as an associate director at the Office of Management and Budget from 1993 to 1995, where her responsibilities included all of the human resource programs of the federal government, accounting for 1/3 of the federal budget. Her research has spanned a wide array of economic and social issues, including fiscal policy, economic growth, poverty and inequality, welfare reform, and the well-being of children, and changes in the family. In addition, she has authored or edited numerous books and articles. In her latest book, Generation Unbound, Drifting into Sex and Parenthood Without Marriage, Sawhill addresses the most important demographic shift of the last 50 years, the trend of young adults drifting into parenthood rather than planning for it. Over half of all births to young adults in the United States now occur outside of marriage, and many more are unplanned. The result is increased poverty and inequity for children. Dr. Sawhill offers actionable recommendations of how we can change course and ensure that every young person can achieve their full potential. Ladies and gentlemen, Dr. Isabel Sawhill.
Thank you very much, Melissa, and also to MetroHealth. I'm pleased to be here. I don't like to tell people these days that I'm from Washington, D.C. We have a terrible reputation. I feel like I need one of those liability waivers that says I'm not responsible for what your elected officials are doing, or maybe more accurately, not doing right now about all the problems the country faces. but I do have some familiarity with public policy from a long career that you just heard about. And I finally came to the conclusion that I needed to write this book because this set of issues wasn't getting enough attention. It doesn't mean I haven't done a lot of work also on all kinds of economic and social questions facing particularly disadvantaged children. My last book, for example, was called Creating an Opportunity Society, and it was more about all the things we need to do to help children climb the ladder, especially the disadvantaged. By the way, my husband was born in Cleveland, so I feel like I have a little bit of root here. He didn't live here very long. I think he moved away, or his parents did, when he was 2. But so I'll claim up just a little bit of an honorary affiliation with Cleveland. And I have some very good friends here who I was able to stay with last night, so that was nice to get a chance to catch up with them. So, the book, as you've already heard, and as you can see on the screen, it is called Generation Unbound, and the reason is because it does focus on the youngest generation, think millennials if you want. And, you can see that I am definitely not a millennial. I am whatever the reverse of a millennial is. I mean, I think I'm even older than a baby boomer, if that's possible. And so I have seen an enormous transformation in the family just during my own lifetime. And for those of you who are younger, I'm sure you've read about this, but you really just can't imagine how dramatic the changes have been. And the reason I call it Generation Unbound is because I think young people have so many more choices these days in our society than they used to. I mean, they can get married or not, they can have a child within marriage or outside of it and not be stigmatized. Gay marriage is now, and gay equality is now becoming widely accepted. So there are just all these choices that people didn't have way back when I was, say, 20 years old. Think about just how our language has changed. When I was growing up, you called a baby that was born outside of marriage an illegitimate child. We wouldn't think of using that language now. You called a woman who was living with her boyfriend a woman who was living in sin. You called someone who had sex before marriage, especially if they were female, it was a double standard, of course, a loose person or something worse. So, all of that has changed, and I think that language gives you a sense of how much. Let's talk about the main themes of the book, and I'm going to just go through them. First, a little bit more on what's happened, then why it's happening, why it matters, and what we might do about it. Starting with the what, let me give you the statistic that probably many of you know, but I've been interested when I look on Twitter, that this statistic is the one from my book that is being tweeted about most. I mean, I've been amazed, and people in other countries are tweeting about this. Did you know that in America, 40% of all children are born outside of marriage? Now, that's the data for everybody. If you just look at the millennials, at the young adults, the people under 30, then this is over 50% now. So that's becoming kind of the new normal almost. We might be at what you might call a tipping point. Now, there are big differences by education level, by race, by socioeconomic status, but I think this is the statistic to stay focused on, and I can get into the details if any of you are interested later. Now, the unwed childbearing rate has been going down amongst teenagers. And so that's the good news. I am affiliated with an organization called the National Campaign to prevent teen and unplanned pregnancy. And we started working on this back in the mid-1990s, and we're very proud of what's happened to the teenage pregnancy and the teenage birth rate. For those of you who don't know, the teenage birth rate is at its lowest level since we first started collecting the data at the end of World War II. So there's a success story here. But in the meantime, the problem has kind of crept up the age scale. So the 20s are the new teens. And as you can see in the top line in this chart, those rates, although they've dipped a little bit recently, are about twice as high as they were back in 1980. And by the way, that recent dip, I think, is probably mostly the result of the Great Recession, and it'll probably trend back up again when the economy gets stronger, but we don't know that for sure. Maybe if my book has a big impact, we'll keep that line going down. That would be my fervent hope. Now, not all of these women who are having unwed births are doing it alone, obviously. And in fact, a large fraction of them are living with the father of the baby at the time the baby is born. And so we've seen a continual increase in rates of cohabitation, and that causes a lot of people to say, well, what's wrong with that? Isn't that just marriage without a piece of paper? And aren't those kids going to be just fine? After all, they have two parents. What more could you want? And I think that it's possible that in the future these relationships could be more marriage-like, but they aren't right now. They are quite fragile. And here's the data on that. If you were cohabiting with the father of your child when the child was born, your chances of having split up by the time the child is age 5 is about half, 48%. Much less stable relationships than marital relationships. Now this could, as I say, change over time. In some European countries, we see a lot of cohabitation. It looks a little bit more like marriage than it does in the US. And we may evolve towards a more stable situation. But right now, there is a lot of instability here. What about what's driving these changes? Why is all of this happening? These are the 4 factors that get listed most frequently in all of the literature on this topic. The first one, I think, is obvious. As women have had improved opportunities to earn their own income and support themselves outside of marriage, they are doing so. They're not as dependent on marriage and on male earnings as they used to be. And they also no longer have to get as much of their identity from being a wife and a mother. They now have other roles that they're playing in our society, and I think that's really weakened an institution which, after all, in recent times anyway, was mainly a way of taking care of women and children. In addition, we've seen declining economic prospects amongst young men, especially less skilled young men. And living in this community, that manufacturing jobs that used to pay $50,000, $60,000, $70,000 a year to even a guy with just a high school education, they're disappearing. These well-paid jobs just aren't there anymore. We have a lot of low-wage service sector jobs now. This last recession has exacerbated that bifurcation in the labor market. The sort of low-paid jobs have been coming back, the well-paid jobs not so much. And our education system has not kept pace with the needs of employers for better educated, more skilled workers. So no question that this is going on. By the way, if you look at men in their mid-30s, let's say, and compare their wages right now, with what their father's generation earned, adjusted for inflation, they are doing worse, these young men. Now, no question that they're worse off. There is a question in my mind is what role has that played in the decline of marriage? I think it's played some role, but I don't think it's played as large a role as some people argue. Why? First of all, if you think about it, two incomes, even if not as adequate as one would like, are always better than one. And that second income can do a lot more for a family than even the most generous social programs. And we really can't replace the family with social programs that are very costly, especially when we're getting to a point when half of young America is in this unmarried state. Third factor here is greater access to contraception and abortion, something that I think has been very good for women. I mean, all the research shows that that access has enabled them to take advantage of opportunities to control their fertility, to be able to do so, but it's also changed the whole sexual landscape out there. And Janet Yellen, the current Fed chair, and her husband, who's a Nobel Prize winning economist, they wrote a paper at one point that gets cited now because of her elevated position, arguing that access to contraception and abortion caused men to feel less responsible when they fathered a baby, because they said to themselves, well, that's the job of the woman. If the woman isn't using birth control, that's her problem, and if she chooses not to get an abortion, that's also her problem. So just a little interesting aside on the Yellen-Akerlof view of this. But clearly, we have a lot more sexual activity at young ages, including teenagers, and that's people are having sex, they're getting pregnant. Finally, changing social norms. I alluded to this a moment ago when I was talking about the change in our language, but I would say this has been hugely important. These new ways of raising children are no longer stigmatized. They're no big deal in many communities. This is just the new accepted pattern. Okay, why get excited about all of this? Does it really matter? And my answer in the book is that yes, it does matter, that all of the research suggests strongly that children raised in two-parent families do better on average than those raised by a single parent. That doesn't mean there aren't single parents who aren't doing a terrific job. We social scientists, we talk about averages, we don't talk about individual cases, so don't misunderstand me here, but if you had a daughter and you were advising her what to do, you would probably want to say, well, the research suggests on average you're better off if you've got two parents raising a child. Amongst other things, child poverty rates are much higher, 4 to 5 times as high in single-parent families as in married-parent families. And we also have some research that suggests that marriage makes people happier, healthier, and wealthier. Finally, I've gotten concerned about the fact that this phenomenon of people having children outside of marriage and too early and often unplanned is breaking out along class lines. If you look at the very well-educated, I'm talking about people here who have 4-year BA degrees, the out-of-wedlock childbearing rate for that group is only 12%. It's still pretty low. It's not anywhere near the new normal. But for everybody else, which is, by the way, 2/3 of the population, only 1/3 have that BA degree. The other 2/3, it's 58%. So it definitely is the out-of-wedlock childbearing rate. So it definitely is becoming the new normal. But it's also creating this class divide in our society. We all know we have more income inequality than we used to. We also have, bigger educational gaps than we used to between low-income and higher-income kids. And add this divide in the way families are forming, and it is all adding up to a kind of toxic combination that is creating a group of haves on the one hand and a group of have-nots on the other. Haves and have-nots across multiple dimensions, not just income. And then finally, this can get costly to society. I'm sure I don't have to tell you all that. You probably see this on the ground, many of you anyway, much more than I do. This is creating all kinds of demands on social services, on the safety net, and on the way education works in the classroom and so forth that is something we're all struggling with. Now, one of the debates about everything I just said is it's not clear which is the chicken and which is the egg here. A lot of people argue, quite correctly, that if you have a lot of poverty, you have a lot of inequality, that's going to cause the kind of family breakdown that I've just described. And that's true. I don't think there's any way to get around that. And then other people argue, well, but if the family starts to break down, if you have more single parents, more unintended childbearing amongst people in their 20s, that's going to cause poverty. And that's true too. As I just told you, the poverty rates for this group are much higher than for those who are delaying childbearing, getting married, doing things the old-fashioned way. And, in the academic research, we get into this in a big way because we have to have methodologies to try to sort out the two, and people, including me and my colleagues at Brookings, we've tried to do that. And our conclusion is it's some of both. In other words, poverty does lead to family breakdown, but family breakdown leads to poverty and less social mobility. And so it's some of both. And my conclusion from that, maybe a little boring, but I think correct, is we have to work on both. We shouldn't have an agenda that's only focused on reducing poverty and improving opportunity, but we also shouldn't just focus on what we can do about family structure and relationships either. So I want to say just a word or two more about these costs to society. Single parents do get, on average, quite a lot in the way of government benefits. I'm not saying they don't need them. I'm just saying it's expensive for taxpayers. And one reason why I was on the welfare reform task force back in the Clinton administration. And one thing we heard over and over again, especially from Republicans, but not only from Republicans, was, welfare is causing the breakdown of the family. These mothers can get AFDC, and they're having babies so they can get on AFDC. Well, the research didn't really support that thesis, but at the same time, there's no getting around the fact that these families do need a lot of support. Just to give you a rough idea of the magnitudes here, take the SNAP program, the food stamp program. It costs right now about $80 billion a year. This is all federal dollars. And it reduces the child poverty rate, according to the Census Bureau, by 3 percentage points. Then look at what's happened to the change in the family since the 1970s and ask yourself, even after adjusting for all the other things that have been going on over that period, which I've tried to do, how much did that by itself increase child poverty? And my answer, my estimate from the research, is about 5 percentage points. So we need, another way to think about this is we need something like the entire SNAP program just to offset this increase in single parent families. I think it's becoming a kind of a tug of war now between the two. you have a lot of social programs and a lot of efforts that I'm sure many of you undertake to reduce poverty, to make the lives of these struggling families better. But at the same time, you have that you're lifting people out of poverty and helping them move up the ladder with whatever we're doing, both in the nonprofit sector and in the government sector. We have the continued deterioration of family relationships, which is causing more children to fall into poverty or be born into poverty. And so I'm calling this a tug of war, and right now my sense is it's about a tie, and that once again we need to work on both. We can't just work on one half of this equation that you see in this chart. In addition to the fact that it would get expensive if we didn't do anything about it, the American public is, and most taxpayers, don't like the idea of having to pay more taxes to pay for people who are doing what they view as somewhat irresponsible, which is having children that they can't afford to support. My own view, and I've written a lot on this, is that we should be reallocating resources from the elderly. That's where most of our federal resources go. They go to Social Security, they go to Medicare, they go to Medicaid nursing home care. They don't go to disadvantaged children and their families. And I would like to see us moving, resources from one to the other. From the affluent elderly, I get a Social Security check, believe it or not. I don't need a Social Security check. I actually made a contribution, believe it or not, to the U.S. Treasury out of my own, private bank account because I felt so badly about it. But, that's the way our policies are right now, and we could afford to cut back on the benefits that are going to the well-off elderly and fund more services for those in need. But that's kind of a separate topic. So what do we hear from our politicians? I hope you recognize these two faces. The first one is Senator Marco Rubio, and he's getting a lot of attention these days, and he may run for president. And here's what he says about what's going on and what we need to do to reduce poverty. He says it's not a government spending program that's needed, it's called marriage. And he's right, at least partly right. And then we have Hillary Clinton saying, well, children aren't rugged individualists, they need our help, it takes a village. We all have to care about this. They're our children, not just, somebody else's children. And so that's kind of where, the public debate has been. And I, as I've just suggested, don't totally disagree with either side in the debate because I think it's both. But I'm adding a third, more provocative, somewhat more controversial item to the agenda here. And, the long, boring way to talk about it is changing the default from childbearing by chance to childbearing by choice. For short, in my book, I call it changing drifters into planners. And by drifting, I mean someone who didn't plan to have a child but has one anyway, and they themselves did not yet feel ready to be a parent. So this is not my judgment about whether they were ready to be a parent. It was their judgment, and we have a lot of drifters. Here is a statistic that blows my mind a bit. The percent of women who agree with the statement, it doesn't matter whether you use birth control or not, when it's your time to get pregnant, it will happen. In other words, a kind of fatalism, a kind of like, you don't plan these things, they happen, they're a natural part of life. And I understand that view, but I think it's not so good that it's so widespread. And I mean, the most important thing that most of us ever do in our lives is decide to bring a child into the world. And my argument, it should be a conscious, explicit decision, not something you just sort of do because it happened. Some of you may know this book by Danny Kahneman, who is another Nobel Prize winning scholar at Princeton, and he wrote this book that I think got close to being on the bestseller list called Thinking Fast and Slow. And what evidently is happening here is that a lot of people are thinking fast or not thinking much at all. And this is an area, childbearing, where we should all be thinking slowly. Now, I'm not saying we don't all make mistakes. I've made mistakes. I'm sure some of you have made mistakes. I can give you trivial examples. I was at dinner last night. I'm trying to lose weight. They were served chocolate, which is my favorite food, at the end of dinner. I had told myself up front, I'm going to have one piece of chocolate. I'm going to allow myself one piece. Guess what? I had three, at least three, because I'd had a glass of wine, and of course you know that, or maybe two, and you know what that does to your self-restraint. So, don't want to be preachy here, but this is not an area where, chocolate, well, so maybe I gain a little extra weight. It's not the end of the world, and it's only me that it affects, not the next generation. So if you schematically try to think about what does the population of planners look like versus the population of drifters, and I have a lot of data on this in the book. The planners do something that at Brookings we call following the success sequence. And the success sequence is first you finish school, hopefully college, then you get a job, then you find a relationship. Maybe you go through several relationships. I think people have to learn about how to have good relationships. I don't think it's something we're born with. And so you go through a number of relationships. You finally find someone that you really think you could make a long-term commitment to. You marry that person, and then you have children together, and you're committed to this for the long term. Now, it doesn't always work out, and you might not be the best parents, but it's kind of not a bad way to go. And then we have what's the drifters, and this is becoming, as I said a moment ago, the much more common path. You probably finish at least high school. Maybe you even get into college. You may go to community college for a year or two. By the way, there's a lot of dropping out of high school and community college because of an unplanned pregnancy, a lot. You may move in with your boyfriend, your girlfriend, and you may have a kid together after you've moved in together, or you may move in together because you got pregnant. And there's a lot of that sliding into cohabitation. And then, as I showed you earlier, there's a lot of early breakups of these relationships, and then the really troublesome aspect of this to me is it's getting very common for these young adults to go on and form additional relationships with new girlfriends or new boyfriends, have additional children with those new adults, and so you have now a huge amount of instability in the lives of these children, and they have all kinds of half-siblings and social fathers and social mothers, and it's very confusing. And there's been a lot of research by the group at Princeton and Columbia University who collected the data on all of this originally, and they're finding that this has very adverse consequences for the kids. Kathy Eden, who has done a lot of very qualitative research, actually living in low-income communities and observing these patterns, she calls this the family go-round, meaning people just are changing relationships very rapidly and having multiple children by multiple partners. So overall, though, this is not affecting just low income. It is affecting everyone. And if we look at the overall statistic that I developed for this book, it's that 60% of births to unmarried women, whether cohabiting or not, under the age of 30 are unplanned. So, you know, it's not just that these babies are coming outside of marriage. I think even more importantly, they are unplanned. Were not intended. They are part of this drifting. And in fact, I think we have put too much emphasis on family structure per se, on whether people are married or not, and not enough emphasis on the circumstances under which the children were born. You know, were their parents together? Did they have a long-term commitment to each other? Did they have some kind of a plan for how they were going to care for a child? So those are the issues that I talk about a lot in the book. Now there is a definite difference between less and more advantaged women in rates of unplanned pregnancy, or drifting as I call it. And you can see here that the rate of unplanned pregnancies is 3 or 4 times as high amongst the poor as it is amongst those who are not poor. And it varies by race and it varies by education. And in general, advantaged women are doing a reasonable job of planning their families, and less advantaged women are not doing as well. And that may be related to what we talked about earlier, which is lack of opportunity. You know, Marion Wright Edelman once said, hope is the best contraceptive. And I think there's a lot of truth to that. On the other hand, as long as we have these kinds of high rates, we're not going to make a lot of progress. Now, how could we make that progress? This is where I actually think we have some solutions at hand. And that is, we need to empower women, and I don't mean just women versus men, but most forms of birth control are, after all, designed for women and used by women. We need to empower them to use the most effective forms of birth control that are out there, and to know about them and to understand that they're safe and effective. And right now, I can't tell you too strongly that women in this country, especially less educated women, don't know about their choices and haven't had easy access to them. And what I'm talking about here, when I talk about effective forms of birth control, I'm talking specifically about long-acting reversible contraception. We call it in this field, some of you may know, LARCs. I have to explain to my friends that that's not a bird in the meadow. It's a particular form of birth control. It includes IUDs and it includes implants in particular. And one of the things that I do in the book, and when the New York Times wrote about my book, they did the graphics editor at the New York Times did a sensational job on showing this visually, and this is a variant on what he did. Bear in mind that this is showing you on the bottom axis there the years that someone has been sexually active. And then the vertical axis is the cumulative failure rate. In other words, your probability of getting pregnant using different forms of contraception. So what this is showing, but bear in mind, most people nowadays are sexually active for at least 5 years before they get married, if not 10. You know, you start your sexual career, so shall we call it, at 18 or 17 and don't get married until you're 27 or 28, which, by the way, is the average age of marriage for women now. You're going to have a long period when you're sexually active. I don't have any problem with that, except it would be nice if you had some way of protecting yourself from an unintended pregnancy. Now, if you and your partner are using condoms, which I understand everybody needs to use because of STIs, but they're not so great at preventing pregnancy. At the end of 5 years, the typical user with condoms will have a 63% chance of pregnancy. So what about the pill? Well, that's 38%. That's the middle bar there. And then the IUDs are much, much lower. The copper IUD about 4%, and the hormonal IUD way lower than that. And this is not because they're better devices technically. It's because the usual forms of birth control are very difficult to use consistently and in a disciplined way. How many people are going to reach for the condom in the heat of the moment? And how many people are going to remember to always take a pill every day? And how many people, when their prescription runs out, are going to, in their busy lives, remember to go get it refilled and not have a period when they're uncovered? So mistakes happen, lots of mistakes, and they accumulate over time. So you're probably now saying to yourself, well, do we have any evidence that we could get women to use these new and better forms of contraception? And I think we have some very encouraging evidence from 3 places right now. From a project that's been underway for a while in St. Louis, it's called the Choice Project, from a statewide initiative in Colorado, and from a statewide initiative that was launched in Iowa. And want to show you the data from a little bit of data from each of those, because the data is quite impressive. Here's the Choice Project. This was started at the medical school at Washington University in St. Louis. And there's a wonderful team out there that developed this and worked hard on it and have published any number of peer-reviewed journal articles in medical journals now. And what they've shown, by the way, their latest article is in the New England Journal of Medicine, and it relates to adolescents. And it shows how successful this has been with adolescents. But their earlier work was on all ages, all aged women. And this is from the earlier work, again, a journal article. The end of 3 years, the bars on the far right there, you can see if you are using the pill or related forms of contraception, your chances of being pregnant at the end of these 3 years is a little less than 10%, and much, much higher than it is for the shot or for a lark. And not only did they reduce these unintended pregnancy rates by quite a lot, but they also found the take-up rates were very high. I think the latest data is that the women who came into the clinic, they were offered everything. But they were also offered counseling about what's most effective, what's safe, and they then got to choose. Now, about 75% of them chose a lark. And so that was key, the kind of counseling that was done, and they were free. They were free. The cost of a lark, the upfront cost, can be as much as $1,000, depending upon where you get it and your provider, but it's not something that most people can afford. It looks a lot more expensive up front than the birth control pill, although over time it's actually much cheaper. Here are the results from Colorado. I'm pleased to see that the governor, who is a conservative Democrat running for re-election right now, is out there on this campaign stump bragging about this. I thought, well, this is not a topic you can talk about in public life. Well, he's doing it. But one of the reasons he's doing it is because the press has been all over the success they've had. This was a privately funded, foundation-funded initiative in Colorado. They set up clinics around the state. They targeted disadvantaged women, young women under the age of 25. And this was the decline that they got over a 2-year period. And They were particularly, they had even bigger declines, by the way, amongst teenagers, as I recall. And they're also very proud that this was something they accomplished with a fairly disadvantaged group of women, because one of the arguments that you sometimes hear is that, oh, well, you'll never get disadvantaged women to, want to use this rather unknown and scary type of contraception. Of course, many older people, including some providers, remember the Dalkon Shield and all the problems with IUDs, and there's still a lot of myths out there about it. It's not totally risk-free, nothing is, including pregnancy itself, but it is pretty low risk, and it's now been endorsed by both the American Academy of Pediatricians and the American College of OBGYNs as, I quote the college, should be the first line of defense against an unintended pregnancy, meaning that it's so much more effective than anything else. Why are we not promoting it? We healthcare providers. This is the data from Iowa, kind of same story again, pretty high take-up rate in the top chart there, and or increase in the take-up rate, still not high enough. This was an earlier initiative, and good news in the reduction in unintended pregnancies in the bottom chart. Now, my book is not just about LARCs and changes in family formation. I have, in the process of doing my research, discovered a lot of things that I hadn't really focused on that much before, and a lot of people have said to me, well, what would you tell the generation Unbound, the millennials? And so these are my what I call my 5 inconvenient truths about sex and parenthood that every young person should know from the research. And the first I've already talked to you about, which is that if you really want to be protected, get an IUD. I have research assistants with degrees from top universities at Brookings stopping me in the elevator and saying, guess what, I just got my IUD. So exciting. The second point is much more serious, which is we now have research, some of which we've done at Brookings, some of which has been done by an academic named Martha Bailey, that if you can prevent these unplanned births, it doesn't just affect the parents, the mother and the father of that child's educational and career opportunities. It does do that. It also affects the success rates of the children themselves. And in particular, they get more education than they would have if they had been unplanned. And in one of her papers, Martha Bailey, this academic who's done such great work on this, explains all the mechanisms for that, which get kind of complicated, but she's a very rigorous scholar, and this is a peer-reviewed journal article, and this is impressive stuff. Third lesson, cohabitation looks great, but for all the reasons I suggested earlier, it may not be a perfect substitute for marriage. The fourth point is the research shows pretty strongly, I got married very early, by the way. I had an unplanned child, so, but later marriages are more stable than early ones. If you want to, and a lot of young people are afraid of divorce. They saw their parents getting divorced a lot, and so they're chary of getting married themselves because they don't want to go through a divorce. They've seen that in the previous generation, and they don't like what they've seen. But this is an argument for waiting until you've got a good sense of what you want out of life and what you want out of a partner, and then being ready to make the commitment, but not when you're too young to really know what you want out of life and what you want out of a partner. So up until your early 30s at least, marriages are more stable the later you enter into them. Again, this is just the average. It's not going to be true for everyone. I married for 40 years. Finally, I think a lot of people don't realize how expensive it is to have a child. We all know about, the Department of Agriculture puts out data on this regularly. They are saying right now, I think, that the average cost is something like $250,000, $260,000. That doesn't include college. It doesn't include the costs of someone staying home, even for a small part of the time, to take care of the child, maybe for the first year, or maybe to work part-time when the child is still young. You put in those costs, then it's much more like $500,000 to $1 million per child. So it's another argument for why, you should think carefully before you do this. If you really want to do it and you're committed, great. If you're not a good idea to go into it too casually. So let me end with what government needs to do and what individuals need to do. On the government policy front, I'm all in favor of creating more opportunity for people. We have a model at Brookings that we call the social genome model. It's a life cycle model. It tracks children's life trajectories using longitudinal data from birth to middle age. And we can see how much difference it makes whether you're, what the circumstances of your birth are to your later outcomes. We have also looked at what we could accomplish if we intervened with evidence-based programs at every life stage. So we, for example, have run a simulation in which we say, assume that all low-income children got an effective parenting program when they were infants and toddlers, their parents did, that they got a high-quality pre-K experience, that in elementary school they got a good reading program like Success for All, which is in many schools now and has a very good evidence base. Also some socio-emotional learning programs for these kids, because it's not just your cognitive skills but also your non-cognitive skills that matter. In high school, we've looked at several different very effective programs. There's one in New York called, that's in many public high schools in New York City now. It's called Small Schools of Choice, and they have smaller learning communities. They have a lot of they have stronger relationships between teachers and students. They have brought in the community, the nonprofits and so forth to work with the kids, so they have a much more integrated system, and they have more contextual-based learning. And they've had really quite wonderful results. Anyway, we say suppose, it's a kind of what if, because it's a model. What if we could give these lower income kids all of these programs at every stage of life up through high school? We're able, if our model is right, to close 70% of the gaps in lifetime income between low income and higher income kids. We use a 200% of poverty cutoff, by the way, for those of you who care about such things. And, when I first saw those results, I thought that can't be, told the research assistants to go back and fix this and fix that. It still kept coming out pretty good. And a couple of messages coming out of that. One is that it's very cost beneficial. I mean, the benefits to taxpayers would exceed the upfront costs. But of course, the costs are all now, and the benefits come later, so that's a political problem. And there's also concern that in the process of scaling up a program that might have been a small demonstration program initially, you may get a dilution of its quality, so you have to worry about that. But it also suggests you can't have one magic bullet. You got to get this is what I think is probably good about community solutions, and you're all getting together, is you can't just do one thing. You have to kind of do it all. At the federal level, I've argued for more career and technical education, raising the minimum wage to $10.10, expanding the earned income tax credit, but you all know about that. On this family planning front, The Affordable Care Act has the potential to change the landscape here because, as you probably know, the contraceptive provision in the law is that women should be provided any FDA-approved form of contraception at no cost. And that includes people on private health insurance plans, and it should include people on Medicaid as well. Now, I understand there are huge differences in Medicaid across the states. Not all states have taken the Medicaid expansion. There are different income limits on this in different states. You can tell me what the situation is here. We also know, of course, that there have been legal challenges to this contraceptive provision in the ACA. The latest and most commented upon aspect of that is the Supreme Court decision in Hobby Lobby to not to excuse certain small private employers from covering all forms of contraception in their health care plans for their employees. And there will be continuing legal battles there. There is, I think, a healthcare provider piece of this. I am told by my friends in that field that there are too few healthcare providers who are well trained in these newer methods, and they're therefore not always offering them, and that's a problem. So I have talked in other places about the need for HHS to do more training and educating of healthcare providers. And then I think women themselves, as I said earlier, do not know about these options and their effectiveness. So I've also proposed in another paper a social marketing campaign aimed at simply educating people about what's out there and what difference it could make. Now, I don't think government can do this alone. My old boss, Bill Clinton, used to say, government doesn't raise children, families do. And that's a very simple statement, but I think it really is true. And of course, we had this old social norm, which I mentioned about, you shouldn't have a child outside of marriage. If you do, you're going to be stigmatized, et cetera. And that stigma worked pretty well. I mean, if you were in my generation and you got pregnant as a teenager, you got sent off to Aunt Hattie's farm to have the baby, and your family was very embarrassed about it all. That norm is kind of disappearing, and maybe that's not such a bad thing, although I still think marriage is good. We need a new social norm, which is what I really am arguing for in this book, which is don't have a child until you and your partner are ready to be parents. It's not much more complicated than that. So I will stop there and welcome questions, comments. Love to learn what your own experiences have been, because one of the reasons I do things like this is to hear from people who work on the ground with some of the people I'm talking about in this book. I don't want to always be, out to lunch because I'm at 4,000 feet. So tell me what it's like at 1,000 feet. Thank you.
Well, thank you, Dr. Sawhill, for your informative insights. Your book has certainly raised some very important questions, as have your remarks, and we will discuss that shortly with our Q&A session. I would first like to introduce our moderator for Q&A, Dr. Jennifer Baylett. She's the Executive Director of the Women and Children's Patient Care Unit here at MetroHealth.
We do have people who will be coming around with mics as I get mine set here. Can you all hear me okay? Okay. So we're going to be taking questions, and I'll just kick off if you would. So when you present your data, you show that the teenage pregnancy rate has dropped, and yet this is a problem you're describing as people in their 20s. So if we have teenagers who sort of have the knowledge and the practical usage of birth control in their younger years, what's happening in their 20s? Why is this changing, and how do we affect that?
It's a great question, and it does make me hopeful that if we could do it with teenagers, we can do it with the 20-somethings as well. Now, when you read, and when we get asked, which we do a lot at the National Campaign to Prevent Teen and Unplanned Pregnancy, why is the teen pregnancy and birth rate drop so much? We can't point to a single smoking gun. It seems to be, most recently, no question that the recession has played a role, because you've seen a big acceleration during the recession years in the drop. Another thing is, I think we have gotten better at teen pregnancy prevention in the schools, in the communities. Some of you may have read about Milwaukee. They did a community-wide effort to reduce their teen pregnancy rate. They had quite a lot of success. They're very proud of it. And, you know, it was the old boring stuff of getting everybody together and getting everybody on board and singing out of the same songbook and doing what they could do in their sector, whether you were the schools or the business community or the nonprofit community or the health workers or whatever. I think that social media, well, another thing is there's definitely been, I think, a change. This is a lot harder to argue because I can't really point you to data on it, but there seems to be an emerging consensus, even amongst young people themselves. It's not a good idea to have a kid when you're still a teenager. Again, that's a changing social attitude, and one of the reasons I'm hopeful is because my message is, well, you might not be ready when you're 24 either, you know. Another thing is social media. At the national campaign, we have experimented a lot over the last decade or so with using Hollywood, using celebrities, using social media to reach teenagers and young adults. We have a new website which is called bedsider.org. Write it down, take a look at it. Bedsider.org is a site that is intended for 20-somethings. Of course, the teenagers are looking at it too. It's got full information about all forms of birth control, what their advantages and disadvantages are, and you can put in your zip code, and it will then tell you where's the nearest clinic that you can go to get whatever it is you need. And we have just, we haven't even published it yet, but we have a preliminary evaluation by an independent group of whether this bedsider.org is moving the needle. It is. The people who are using Bedsider are having fewer pregnancies than those who are not, who are presumably comparable. And so we're very encouraged about that and think more can be done in that area. Some other academics done an article on the MTV show 16 and Pregnant, and found using a very powerful and creative methodology that 16 and Pregnant has reduced the teen pregnancy rate by quite a lot, that about a third of the drop in recent years in the teen pregnancy rate was due to this one program on television. So we think working with Hollywood, with TV, with the online sites that teens go to is critical. By the way, when we have focus groups with teenagers and we ask them about their sex education or health education programs that they had in middle school or high school, they just, you know, shake their heads and say it was boring, or it was too late, or it was too early, or it was not relevant, or, you know, whatever. They're not big fans of that. And that's not where they get their information. I forget the exact statistic now, but something like, 89% of young people sleep with a cell phone next to their bed, and they're on them, as you know, all the time. So we have to keep up with, I call this sex education for the 21st century. It's not going to be done just, nothing wrong with the classroom stuff, but you got to do it in other places, in other venues. We're also working with community colleges now because we've discovered they have a huge problem. And nobody ever thought about working with community colleges. Everybody thought we should work with, people before they get to college. And by the time they get to college, this is not a problem anymore. Not true. The other thing, I'm going on too long, but the other thing that our research shows is I always thought everybody knows the biological facts. they know about the birds and the bees. Well, it turns out they don't. I mean, the myths out there about, oh, well, you can't get pregnant if you have sex for just the first time. Or if you had a few sexual encounters and you didn't get pregnant, that shows you must be infertile, so you don't worry about it. I mean, there's just a lot of myths out there. I probably don't have to tell you that.
There are a few more I could share with you,
Yeah.
but I think I'll in the interest of time, keep going. Do you have questions from the audience? Yes, ma'am? Oh, she's got the mic, so I'll go to her first. You're next. Go ahead.
Hi.
Hi.
It's an honor to meet you and be here. I was an intern at the campaign probably 13 years
Oh,
ago.
wow. Oh, wow. What's your name?
My name is Lindsay Marcus. So I have many questions. My mind is actually sort of spinning, actually. But one of the questions I have is, and I left the campaign and became a sex educator, and I've been a sex educator for a decade, and we keep telling teenagers to not get pregnant and to not, spread STIs and all these different messages, and then I'd be working with them in this direct service role, and then as soon as they leave my program, they would become pregnant or contract an STI. And so we tell them to wait until their 20s, wait until they're ready, wait until they have an education. And you're bringing up these ideas of, okay, so they're waiting now, but they're waiting until their 20s. But what is...
Maybe that's one of the reasons for the...
Yeah, I mean, and so there's very likely folks who have jobs, whether they're career jobs or hourly jobs, and you talk about minimum wage. A lot of my question is regarding around policy of supporting parental leave and early childhood education and daycare for individuals who have children, and I just thought maybe you had some perspective or insight to those things also.
Well, those are the issues that I mostly addressed in the earlier book, but yeah, I'm in favor of all of the above. I think that on the paid family leave, there's a legislation in Congress right now called the Family Act, all in caps, family, on paid leave. Provides 3 months of paid leave. That's minimalist compared to some other advanced countries, but I think it would help. And I think we definitely need more subsidized child care. The co-author of my last book, who was the senior Republican aide on the Ways and Means Committee, I had to pull and tug a little bit, but I got him to agree with the recommendation we had in the book to really expand subsidized child care. One of the things that should be done on that front is we have this thing called the child care tax credit, not to be confused with the child tax credit. The child tax credit goes to you just because you have kids. The child care tax credit is an offset to expenses on child care. Problem with it is low-income workers can't access it because you have to have a high enough income and pay enough income taxes to make the deduction worthwhile. So some people, including me, have proposed that we make the child care tax credit refundable. When I was in the Clinton administration, I proposed that we cap it at $100,000. In other words, that if you had an income of more than $100,000 a year, you would not get it. And the politics of that turned out to be impossible. So there are a lot of ideas. The problem right now, as you know, is the politics of all of this. Early childhood education, absolutely. Probably has the highest benefit cost ratio of anything that was on the list of things I went through earlier. Again, the states are doing more than the federal government on this front. And some of them are doing quite well, and some of them less well. I don't know what the story is here in Ohio.
Miss?
Good morning, happy Tuesday, I'm sorry. Tiffany Scruggs from University Settlement, and I was just curious, I'm over here.
I'm sorry.
I'm sorry.
Oh, okay, yeah, I couldn't find you.
You touched briefly on poverty, and I think I'm truly equipped to talk about families, meet with families every day. But for us, we're seeing generational poverty. So we know that there's a huge difference between being first generation, kind of born into, or a situation occurs, which then gets you into that poverty situation, versus being poor, where you might have the same value systems as someone in upper or middle classes, versus those families and children who are being taught how to be dependent on government benefits and really being taught to stay within a socioeconomic status. So I don't know if your book touches on that or if you have any other literature that you could suggest, but it's just been very difficult. I mean, we practically bring programs and support to families' front door, and we're still seeing some of the same outcomes, which aren't so great.
Well, I think you make a very important distinction when you talk about sort of generational poverty, very long-term persistent poverty versus the kind of temporary poverty that some people experience because they lose their job or what have you, and or have their house taken away from them. It's a tough problem. I think, when I talked earlier about there are some economic trends that help explain what's happened in this arena, I think there's an interesting dynamic that occurs between economic factors and what you might call cultural factors. So that once a particular way of having children or interacting with the government or whatever it is becomes the norm in that community, and you see it amongst your friends and your relatives, then you adopt it as well. And so I think the old Moynihan report on the what he called the Negro family, as that was the term in those days, came out in 1965. He was highly criticized for blaming the victim, for talking about race being a problem with family structure. And my first book on this topic was funded by a foundation that wanted to know what was the truth or untruth behind the Moynihan report. So I remember these controversies extremely well. But one of what relates to your question about that is that what Moynihan found, he was then a high-level official in the Department of Labor in the Johnson administration. War on poverty has begun, and they're trying to figure out what to do. President Johnson is trying to decide what to do. And Moynihan talked about what he called the scissors effect. He had data that showed that there was a very tight correlation between the joblessness rate of young African American males and the rate of single parenthood up through roughly the early 60s, let's say. And then the two trends just completely diverged and the correlation went away. And how do you explain that? The way I would explain it is that maybe there was initially economic and other reasons like discrimination and so forth that set this off, but once it starts going, it takes on a bit of a life of its own. Does that make any sense to you?
Hi, I was wondering in terms of, you mentioned social marketing program in terms of contraceptive education, which I think is a good thing. In terms of your social norm, don't have children until you and your partner are ready to have parents, is there a role of government to market that to young people? And the reason I ask is that you're swimming upstream against, I have 4 children, the oldest of whom is 21, and when I watch the media, the shows, the movies that they have, the clear message is if you're not having sex in high school, you're strange. Mm-hmm. I talked to my son who's at a relatively conservative college, and he says it's not outside the norm for a couple to meet for the first time in a bar and have sex that evening. Mm-hmm. How do you, when you have all of the media saying that's the norm, how do you convey a more responsible lifestyle in suggesting that you wait or you be more responsible in your choices? Is that a role of government, or is that not a role of government in addition to the idea of educating about contraceptives?
Well, I don't think it's primarily a role of government, no. I think it needs to fall more to nonprofit organizations and leaders and parents, older parents like you, to talk to younger people about your own views about this. And I think that there has been a tendency to be fearful about speaking out about these issues for fear of looking like a dinosaur. I mean, I have to worry about that. I am a dinosaur. But I decided, well, I'm going to talk about this because I think it's so important. I really believe that, having children in responsible ways is critical to their future well-being. So I don't have any magic solutions for you. I mean, I think when someone like President Clinton talked about the family, when Barack Obama talks about the family, when George W. Bush talked about the family, I mean, most presidents have used the bully pulpit to talk about these issues. When Mitt Romney was running for president, he many times on the campaign trail cited our research at Brookings on the success sequence, and he said, if you follow the success sequence, first finish school, then get a job, then get married, then have children, your probability of being poor will be less than 2%. And he loved to cite that statistic. Now, he didn't tell people how we were going to get people to do all those 4 things. I think it does take leadership and new messages. And you're right that the media is not helpful, although you have something like 16 and Pregnant that I just talked about that actually has been helpful. So it can go, the media effect can cut either way.
That corner?
My name is Dick Marsh, and I live in Summit County, Ms. Sawhill, and for your information, that's just south of Cuyahoga County. And my thought is that your costs, you gave a government cost of $6,000 per person per year, is far too low. That probably is the federal government cost. But
It is.
But when you begin to measure the impact on the local government institutions and so forth, for example, what happens in juvenile court, how many of those kids are of single parents, for instance, in Summit County, 90% of the kids who have serious crimes are all single parents, and some of those kids have kids of their own. And so what that cost is, what's the cost to the hospitals? What's the cost to the schools and the disciplinary problems? And I'll give you one metric that I'm really familiar with. In Ohio, we have Children's Services, which handles kids who are abused and neglected. And in Summit County, the budget there is $50 million a year, approximately. Of all the people going through there, 80% of them or more are kids who have single parents, or the single parents are the ones who are referred there. Mm-hmm. So right there's $40 million, in Summit County. So what I'm saying is, I think there should be more effort to get people to estimate what their local costs are in addition to the federal costs, and I think the local costs are in excess of the federal costs for taking care of these youngsters.
Really, really important point, and I should have made it myself that my figures only covered the federal costs, and it's very hard to get the state and local costs, as you suggest, and they vary a lot, and they're not easily available. I should have mentioned, though, apropos of that when Colorado did this initiative that I described, their Medicaid director was just thrilled because the Medicaid costs went down so much, and so did the WIC costs, Women's, Infants, and Children Feeding Program, and other costs that the state had borne. And they saw the impact of this on their budgets. And so, when we talk about the choice between improving opportunities, strengthening safety nets, and opportunities through social programs, education, training, the whole bit, versus doing something on this front, the difference is that one costs money, quite a lot of money usually, the other saves money. Even the Congressional Budget Office has estimated that these kinds of programs can actually save taxpayer dollars at the federal level. And you're saying, well, it's even bigger at the state local level, and I think if more states catch on to that, there'll be more governors and other people at the local and state level that will begin to get on board with this. It takes a long time to change the opportunity structure for the youngest generation. If we're talking about starting with pre-K and better elementary school and all that, it's going to be 20 years before we reap the rewards. This is something we can do now, and it's not only cheap, it saves money. So thank you for that comment.
Over here?
Good morning. My name is Barbara Hurd, and I am a tapestry supervisor at the East End Neighborhood House. And I have a question. As far as the family sizes are going, we've seen an upswing of family sizes in generations from maybe even 10 years ago to where we are now. It had gone down to maybe 2 to 3, maybe 4 per household. But in our community, which is in the poverty-stricken community, we have families now that are having 6, 7, and 8 children per household. And I just wondered, did you attribute that to the lack of information to these communities or the accessibility to the monies that for the contraceptives?
Are those American-born, or do you have a lot of immigrants in your community? Can you tell me a little more about it?
American-born.
Yeah? Well, that surprises me because that's not what you see in the national statistics. In the national statistics, you see family size going down, not up. So I can't speak to what's going on in your community. It surprises me.
If I can
Yeah.
add into that, seeing that I deliver a lot of those babies, I think one of the things I see is serial monogamy, and you show your proof of love to the next partner by having a child with them. And so that I see multiple, every time when they get a new serious partner, they seal the deal, if you will, with another child, and depending on how those relationships go, depends on how many kids they have. There's clearly much more that goes into that, but that is one of the things that I see, that the number of kids is determined by the number of partners.
Interesting.
John Collette?
Yeah, good morning, John Corlett with MetroHealth. One of the things I wondered about is, have you seen any programs around the United States that work with these new single mothers, after they deliver, to introduce them to a long-acting, reversible form of contraception? Is there any initiatives out there? Because it would seem like they would be at high risk of being in the same situation again, speaking to Dr. Bailey's point.
Another great question. I don't know the on-the-ground experience, but I do have read articles that suggest that it is a really critical time to intervene, and there's been some resistance in some medical circles about providing a woman with an IUD, for example, before she leaves the hospital after the birth of a baby, but that my understanding, but you tell me if you have a different one, is that it's, or somebody, that there's no problem with that, and that the problem with saying to them, come back later, is they don't come back later. So you've lost this window of opportunity if you wait. What do you think?
I think that's exactly right. However, our healthcare systems are not always set up for the teenager who needs one-stop shopping, or the adult woman who needs one-stop
Right.
shopping. And sometimes by the time you order the IUD, you get the financial approval, which takes a day or two with the insurance company, or depending on, they have private insurance, and then they come back. Depending where they are in their cycle, you have to show that they're not pregnant by the time you put them in. Where are they in their cycle, so it's less painful to put in, these sorts of things. It's very difficult. So the one-stop shopping can sometimes be technically difficult.
Are you seeing an increase in the uptake of LARCs?
It's hard to say. We push IUD. I don't want to say push because that makes it
Yeah.
seem like but we offer IUDs quite often. A lot of people, there's a lot of myths out there about my best friend had a problem with it, my mother didn't like it.
Right,
So
right.
we see a lot of folks who would rather use other methods that are less reliable.
Right.
Yeah, I just wanted to ask you, what about vasectomies for men?
Where are you? Oh,
I'm right
okay,
here. I'm
okay.
right. Oh, I'm right here.
Oh, all right, all right.
Okay.
It is hard to see against the
Okay.
lights. Got it.
Yeah. I just wanted to ask, what about vasectomies for men? Is there any research going on about vasectomy reversal? Because I feel that if it were easier to reverse them, a lot of more men will have them, and that could be an effective form of birth control.
Short answer is I don't know. So good question, but I don't know the answer. Do you?
There's not, as far as I know, not much going on. There are other forms of birth control that are more reversible for men that they are looking into. the vasectomy is technically difficult to reverse, as well as there's an autoimmune component to reversal that's controversial. Having said that, when I've got a woman in front of me and I'm counseling her about birth control, I can talk to her partner about getting a vasectomy, but there's no guarantee they're going to be together in a year. So I'd have to do a lot of vasectomies to find the partner she's going to pick the next round.
This is the family go-round that I talked about. I mean, it's really, by the time a child is age 5, half of these parents have gone on to form another relationship and have a child with another person. It's not just a small group anymore.
Having said that, even when I have people in a stable relationship, the myths about vasectomy dwarf the myths about an IUD. So even when you have a man who's willing, they're very concerned that it will affect their sexual function and not just their performance and not just their reproductive capabilities. I think that sounds like we've answered most of the questions. Please feel free to come up afterwards, and I believe you're doing a book signing next.
Happy to do so.
Please come up and
Yes, please
grab a
give my book to your friends for Christmas. I don't get any proceeds from it, but I still want the ideas out there.
Thank you all very much for attending. We appreciate your time.
Well, thank you, Dr. Bela, and thank you again, Dr. Sawhill. Just a few announcements before we conclude. Generation Unbound, the book is available for purchase at the table outside of the auditorium, and Dr. Sawhill will be available momentarily to sign those books. Thank you again to MetroHealth for hosting this forum, as well as providing the refreshments and taping and recording of the event. We'd also like to thank the Mount Sinai Healthcare Foundation for financial support for this event, and the Third Federal Foundation, Nordson, and the Sherwick Fund of the Cleveland Foundation for their generous financial support of our Human Services Institute this year. Today's presentation will be available on our website, www.communitysolutions.com. Please also follow us on Facebook and Twitter. The Center for Community Solutions has 2 upcoming events in November that we wanted to make you aware of. The first is on November 5th. There's a free training, an advocacy training, Turning Words into Action. It begins at 2:30 p.m. and it will be at Lakeland Community College at the Holden University Center in room 119. Also on November 13th, we will have the celebration of human services at 9 a.m. at the City Club of Cleveland. And for more information about either events, you can visit our website. Thank you for attending this Human Services Institute. We look forward to seeing you in the future.